Du débat, the Honourable Member for Nanaimo, Lady Smith.
Thank you, Madam Speaker. It's an honour to stand here today on the territory of the Algonquin Anishinaabe people to represent constituents in Nanaimo, Ladysmith, and Greens across Canada. There are a number of things in the speech from the throne that I'm pleased to hear. In fact, there are some sections that sound a lot like the Green Party platform I ran on in 2015 and 2019. There are also sections that echo the Green Party's roadmap to economic recovery from the pandemic, reimagining our future. What the throne speech is missing is plans for bold actions in those documents. To quote our new Green Party leader, Annamie Paul, platitudes are not a plan. We are facing two unprecedented crises, a global pandemic and a climate emergency. Both of these crises require that we listen to the scientists and the experts. Both of these crises require bold actions. This speech from the throne does not reflect the urgency of this moment. We keep hearing that we're all in this together, but this pandemic has laid bare the inequality in Canada. Those who have been affected by the pandemic are seniors, women, people of color, Indigenous people, people with disabilities, and low-wage workers. At the same time, the wealthiest Canadians have been making money hand over fist. The 20 richest people in Canada have increased their wealth by $37 billion during the 6 months of this pandemic. It's time for a wealth tax in this country. It's time for the wealthy to pay for their fair share for the public services their businesses and employees rely on. It's time that the internet giants and multinational corporations that do business in Canada pay their fair share of taxes as well. Small and medium-sized Canadian enterprises are suffering from the economic fallout of the pandemic. In particular, the travel, tourism, hospitality, and entertainment sectors need additional help so these businesses can survive. The nonprofit sector provides vital services to Canadians, especially right now. This sector needs additional targeted support as well. Small and medium-sized businesses are the engine of the Canadian economy and employ almost 90% of the private sector workers in this country. These businesses need support to get through the second wave of this pandemic. Madam Speaker, we need to do a better job taking care of each other. We're the only country in the world with universal health care, but no universal pharmacare. It's mentioned in the throne speech, but we've heard it before, and we haven't seen a plan. Universal pharmacare will save billions in unnecessary healthcare costs by ensuring people have the medicine they need. We need a universal dental program to complete our universal healthcare system. This too will save billions in unnecessary healthcare costs. A $90 filling today can save $10,000 in a heart operation down the road. Our recovery must focus on supporting women and family. Canada urgently needs a universal childcare program to enable more women to return to the workplace. Thousands of people across this country are homeless or at risk of homelessness. It's more important than ever that the federal government invest in affordable housing, in particular community-owned cooperative housing. The announcements on housing programs sound good, but the funding needs to flow right away. We have an opioid crisis in this country. Thousands of people have died from drug poisoning. Addiction is a health and social issue. Our public health officers are telling us to follow evidence-based solutions to this crisis. We need to listen. We need a national mental health strategy. The Green Party has long been calling for a national strategy for seniors, including national standards for long-term care and additional supports for home care so people can age in place. Seniors deserve a top-up of OAS and GIS to help make ends meet. Many people with disabilities have been waiting for long periods of time for the benefits and protections that they need. The COVID-19 one-time support payment for people with disabilities was announced 3 months into the pandemic. And it's now almost 4 months later and nobody has received a check. I understand those checks are supposed to be sent at the end of this month. People with disabilities are sick of waiting and sick of being left behind. Veterans Affairs Canada had a backlog of almost 50,000 disability benefit applications as of March 2020. It will take 3 years to clear that backlog with the current resource levels. Veterans deserve better. Young people and students are not mentioned in the speech from the throne. The Green Party has been advocating for the elimination of tuition fees so we can create an educated workforce without burdening our young people with unsustainable debt. Northern European countries all have free tuition. It's a matter of priorities. Let's prioritize our young people. The Canada Student Service Grant was a very bad idea from the beginning, and we know how that turned out. Those funds should have gone into the Canada Summer Jobs Program to help youth and nonprofits get through the pandemic. Canada Summer Jobs was underfunded. In my riding of Nanaimo Ladysmith alone, there was $500,000 worth of unfunded applications. We need to bring our social programs in line with the Northern European countries where citizens have a real social safety net from cradle to grave. The biggest opportunity that this government has missed in the speech from the throne is a guaranteed livable income. Our current patchwork of social programs allow too many people to fall through the cracks. A guaranteed livable income would create an income floor under which no Canadian would fall. It would eliminate extreme poverty in this country. I can hear the objections now. How are you going to pay for all of this? Let's go back to where I began. Canada needs a wealth tax. We need to close tax loopholes that allow people and corporations to avoid taxes in Canada and offshore their wealth. It's worth emphasizing that the costs of social inequality are far greater than the costs of taking care of people to start with. Let's use this resource wealth we have to create maximum employment and benefits for Canadians, starting with First Nations and Indigenous people, who are the rightful owner of those resources. We need to implement all of the recommendations on the Truth and Reconciliation Commission, the Missing and Murdered Indigenous Women and Girls Inquiry, and it's time to implement the UN Declaration on the Rights of Indigenous People. We also need electoral reform. Not mentioned in the speech from the throne, no surprise. There are good things in the speech, and there are a lot of things missing, or things that need to be improved on. But the bottom line is that there is no real plan to do our part to stop our own destructive practices that are wiping out the biodiversity on this planet, destroying our climate, and threatening the future of our children and grandchildren. We still have the climate targets set by Stephen Harper's Conservative government. Pathetic and inadequate targets. And there is no plan to even reach those pathetic and inadequate targets. Since the first climate conference in Geneva in 1979, successive Canadian governments have been well aware of climate change. Only one government actually bothered to establish a plan to meet the targets that they agreed to. That was the Paul Martin government, which was brought down by the Conservatives and the NDP before those plans could be implemented. Britain has set a carbon budget in law. They set plans and hold to those carbon budget targets independent of the toxic partisan politics that dominate our electoral system. The UK has reduced their emissions by 42% below 1990 levels, while Canada has increased emissions by 21% since 1990. Canada is a climate do-nothing. I will not vote for a speech from the throne that does not include the targets that science demands and a real plan of action to meet those targets and address the crisis we are facing. My work here is not to ensure that I get re-elected. My work here is not to boost the fortunes of the Green Party. My work here is not to play a game of partisan politics. My work and role here is to push this government as hard as I can to do the right thing, to improve the lives of Canadians and take real action on climate change. We owe our children and grandchildren nothing less than the full defense of their future on this planet. There are other members of other parties who know this to be true. I want them to know that their work here is to fight for the existence of humanity. Their party bosses and big donors may be interested in making the last chunk of money from fracking, but they need to question what their purpose is on this planet, at this time, in this place. Think about those moments in your childhood when you saw a world full of wonder and possibility. We in this House have the power to make decisions that count, decisions that matter. This is our time to meet the challenge of our time. This speech from the throne does not meet the challenge. It's time to do better. I'll be voting no.
Questions and comments? The honourable member for St. Catharines.
Thank you very much, Madam Speaker. I'd like to thank the honourable member for his passionate speech. He mentioned that universal pharmacare, which is an important plank in the throne speech, that he hasn't seen a plan. I was wondering if he could comment on the Hoskin report that the government commissioned in terms of universal pharmacare and the government's movement to create a Canadian drug agency, to create a formulary, and a commitment for federal funding on rare drugs. Does he support that? Is that a plan? And does he disagree with the Hoskins report?
The honourable member for Nanaimo, Lady Smith.
Thank you, Madam Speaker. I agree with the Hoskins report, which also calls for a universal, single-payer pharmacare system. And we need to get that implemented. There are people in this country who are dealing with very expensive drugs, with rare diseases that need help. And there are seniors, there are families with high cost of drugs, and when people can't afford the drugs that they need to take, they end up in the emergency room, and they're costing our healthcare system a lot more. So let's get that Hoskins report recommendation done.
Questions et commentaires. The honourable member for New Brunswick Southwest.
Thank you, Madam Speaker. So a lot in that. The member wants to harness the wealth of the resource sector, yet the Green Party wants to shut down Canada's hydrocarbons. The minister wants to go after offshore savings, but of course Canadians put money offshore when taxes at home are too high. So his solution is higher taxes. But let me give the member some numbers from Dr. Mark Milkey. If you earn up to $50,000, you're in 68% of the tax filers in this country, and you pay 21% of all personal income tax revenues. If you earn 50 to 100, that's 23% of tax filers, you pay 35% of all tax revenues. 100,000 to 150, that's 5.8% of filers, accounts for 18% of tax revenue. 150 to 200,000, we're down to 2.1% of filers. The members in this tax bracket, and he and other taxpayers account for 13% of all tax revenues. And finally, those that earn above $200,000 a year account for the 1%. They pay 21% of all tax revenue. So who is the member talking about taxing? Is it all taxpayers? Is it those who earn $1 million? There aren't many of those. Is it those like himself that earn 100,000? Who is he talking about taxing? You bring in these
Honourable member for Nanaimo, Lady Smith.
I am talking about the 20 billionaires who made $37 billion during the 6 months of the most economic, catastrophic problem in the history of this country. So those businesses, Jimmy Patterson, what does he need $8 billion for? What do these people need to hoard all this wealth for when in this country their workers are working for minimum wage? Why? So, you know,
Questions et commentaires. The honourable member for Beauport-Limoilou. L'honorable député de
The honourable member for Beauport-Limoilou. I want to thank my colleague from Nanaimo, Lady Smith, for his brilliant speech. And I agree with a number of points. I have a specific question. He often has raised issues that fall under Quebec and provincial jurisdiction. One of the things that interests me most is federal transfers for health. Our needs, according to the Constitution, would be around $91 million. I would like my colleague to speak to the importance of jurisdiction as well as fair health transfers.
Nanaimo, Lady Smith.
well, thank you very much for the question. I believe that we do need to get health transfers to the provinces to make sure that the citizens of this country are taken care of properly. And we need to expand our health services with mental health services that are included in the Canada Health Act, with universal pharmacare, with universal dental care. We need to take care of Canadians properly. It's the responsibility of the provinces to do that, and we need to transfer the money to them to make sure that that happens.